Ladies and gentlemen, you're watching Foodcaster. I'm Michael Michael. And we've got the lovely Sam Eats Plants.
I'm here again.
And you're still eating plants.
Yes. Or I wouldn't be alive.
So, you had a very interesting topic you wanted to talk about today.
Yeah. So, I don't know how many people know this. Heart disease is the #1 killer in the United States. It has been for a few years. It surpassed cancer, like I think 2015 or 2014. I don't know. And one of the things that is a risk factor for heart disease is being diabetic. And some people may not know that. But one of the risk factors for being diabetic is having heart disease.
So they go hand in hand.
They go hand in foot, right?
Hand and foot.
And so I wonder how explored that is on like a regular people conversation. You know, maybe doctors have these conversations, maybe cardiologists have these conversations, but I don't think this is really like known for the rest of us. But they're hand in hand. One is a risk factor for the other.
Wow.
But the question is why? I think essentially, I don't know what you think, but would you assume where the correlation is between heart disease and diabetes? Do you even have a place to even guess what it is? Maybe you do, I don't know.
I would think fats clogging up your arteries.
All right, because we've had conversations about that and
Right.
how it goes with diabetes.
Right.
Because I think most people understand that there's a saturated fat cholesterol issue with heart disease.
Right.
I think that's pretty like standard. Like, oh, your cholesterol's high, your blood pressure's high, your risk factor for a heart attack is high. What people tend not to know is the issue for diabetes is a fat issue.
Oh.
Because most people assume it's a sugar issue. Because they prick your blood and they test it and it says, you have high blood sugar. So stop eating too many things with sugar or glucose
Right.
or carbs in it. And it misses the real root of why you have too much blood sugar. So I want to talk about that. I want to talk about their whole connection, why one is a risk factor for the other, and why when you decrease fat, you lower the risk factors for both diseases and also reverse, and I can say this on like on air because
Right.
it is proven. Okay?
Okay.
You can reverse heart disease and diabetes with the same exact diet. So, here we go.
Okay.
When we consume saturated fat and we don't have enough room to utilize it, it gets put in places, all right? For heart disease, it gets put where we think it gets put. Arteries and veins leading and into the heart, coming from the heart. When it's a stroke, that means the fat deposits are in the arteries and veins going up to your brain. When it's diabetes, it means the fat deposits are getting thrown on top of your cells. Literally, all of these issues are the same issue. You're eating too much fat than you can metabolize. The body has to put the lipids somewhere, lipids meaning fat. They have to put it somewhere. And depending on how your body tries to throw it away, is the disease that you end up getting.
Oh, wow.
Okay, so that people kind of see the whole round thing. And this extends to things that are less prevalent than diabetes and heart disease. This includes erectile dysfunction, lipids in the capillaries, going in that direction. Same thing with renal issues, meaning kidney issues. So when I say renal, I'm talking about the vessels that go into your kidneys. Diabetics tend to have kidney issues. A lot of diabetics, a huge percentage of people on dialysis are diabetic. Why? Because there's too much saturated fat going into the arteries and the veins into the kidneys. All right. So if we understand all of these are high fat issues, every single one of them, well then the answer is reduce your fat intake. Reduce saturated fat. Reduce all fat really, but really reduce saturated fat. So to explain exactly what happens with diabetes, because people keep wanting to place diabetes as a carbohydrate issue. When the fat molecules get thrown on top of cells, they tend to block receptors. And these receptors receive different things. And on top of every cell is also an insulin receptor. If a fat globule is on top of your cell, right where the insulin receptor is, well then guess what? The insulin with the glucose together, because your pancreas produces insulin, the insulin grabs onto the glucose, and they're supposed to go into your cell to give you energy, because that's what gives us energy. But if there's a piece of fat over that receptor in your cell, then it can't go in.
Right.
So it sits where? In your blood. So then when you prick your finger, you test it, it says, oh, you have too much blood sugar. Reduce your glucose, reduce your sugar, reduce your carbs.
Here's some pictures of the pricking the finger. For people who don't know that, if you don't know what that looks like.
And the diabetics test their blood sugar regularly, especially in the morning. You want to see what your fasting lipids are. But if you tell diabetics to reduce their carbs, and carbs and fat are both very heavy in calories. So if you're telling someone to reduce your carbs, so you're reducing your rice, you're reducing your bread, you're reducing your pasta, you're reducing your fruit, the only thing that can increase enough to give you the calories you need are fatty foods, nuts, cheese, meat. So you're literally telling them to eat a diet that's going to exacerbate their blood sugar issue.
Wow.
This is the norm of what we live in right now, still in the medical community, even though on paper, in data, multiple times, a low-fat, high-carbohydrate diet reverses diabetes 100% of the time. 100%. Like, there's no half-stepping. 100% of the time. There is a clinic somewhere in Washington State for diabetics, type 2 diabetics, not type 1. And it's a green smoothie retreat. Like, literally, you're just eating fruit smoothies with greens in them all day. And you have people reversing diabetes in like 6 days.
Wow.
Because there's almost no fat in that. It's just fruit and greens.
So this right here, this is unnecessary. They don't need all these pills and...
They absolutely don't need all those pills, and I can say that because the proof is already published. Like, this is nothing new. Not only that, but the main medicine that is given to diabetics is metformin. Metformin also inhibits weight loss, and most doctors tell their diabetic patients, you gotta lose weight.
You gotta lose weight,
Here's metformin. And now they can't lose weight, and now they're stressed out, and they're following the American Diabetic Association diet, which says, stop eating carbohydrates. And then you have these dinners that they recommend. I mean, there was even a shrimp wrapped bacon recipe on that website.
But that doesn't make sense because even I know that.
Except if the idea, remember, a lot of people who are in medicine don't know nutrition. So all they're seeing is there's too much sugar in your blood. Oh, don't eat any more sugar. That's all they're seeing. Because they don't know the science of nutrition.
Yeah, because look at this article right here. This was April 30th, 2018, focusing on blood sugar levels.
I see a nice amount of fruit there.
Yeah.
It's nice.
Right.
I like to see that. It's still not, that's still not the recommended diet that doctors will give their diabetic patients. So what happens when you're diabetic? And anyone who's diabetic listening can probably relate to what I'm about to say. Your eyesight gets worse. Why? Because you're eating more fat. Now the fat's in the capillaries going into your eyes. Glaucoma, the number one reason why people will have glaucoma is as a side of being diabetic, right? Glaucoma is too much fat in the capillaries.
Wow.
Blocking the light coming in. All of these are just exacerbated, and this is why eventually diabetics will have renal issues, meaning kidney issues, and maybe have to get a kidney transplant, or maybe have to be in dialysis. Too much fat.
Now, wait a minute.
Yes.
Now, let me see. 'Cause putting all these pieces
together
of the puzzle together, and from things that you mentioned on Foodcaster before, the fake food, if the body doesn't know what to do with it, it turns into...
Well, a few things happen. The body doesn't know what to do with it. It tries to get rid of it, right? But if we're at a backup of so much toxicity, because we eat processed foods all the time, sometimes it sits. So toxicity can sit in our fat cells because that's just a place where it goes. That's every mammal. Every mammal, the toxic stuff is in the fatty areas. And then everything else tries to get excreted out. So also hampering your kidneys, because your kidneys and your liver are the main organs that deal with getting out toxins.
So this fat and this miscellaneous junk poisoning you and not being able to move.
Yes.
Wow.
And literally affecting mostly kidney and liver. I mean, when people think about cirrhosis of the liver, I know they think about alcohol, but the number one fatty liver disease is mostly from our diet, not from drinking alcohol. You can still get it from drinking alcohol, but it's mostly our diet.
Right.
And so we are damaging our bodies in general, but damaging the kidneys and the liver in particular, just living our modern life. Like, that is what we're doing mostly. And so you'll see that somewhere, what's the statistic? Like, over the age of 60, like 65% of people have some type of renal issue, kidney issue. Like, it's a majority. It's a majority because of years of doing this. And we don't have a culture of detoxing or fasting. We don't really have a culture of that. You know, Muslims have a culture of that. People of the Baha'i faith have a culture of that. People, Christians could have a culture of that because of Lent, but the way it's practiced is not how it was originally practiced. So people usually just pick like one thing they're not going to eat instead of like a diet cleanse. So we don't really have a culture of fasting in America. So we never give our kidneys a rest. We never give our liver a rest. And then we need a new liver. We need a new kidney. We need dialysis. And we're having all these issues.
Wow.
So this is why heart disease is a risk factor for diabetes, and diabetes is also a risk factor for heart disease, because heart disease, everyone understands, is too much saturated fat. We're blocking up our arteries, we're damaging our capillaries, and we're preventing blood from getting into the heart. We understand that. But a high-fat diet is preventing a lot of things from getting a lot of places.
Wow.
And so that is also why, if you go on a low-fat diet, okay, so what are our most fatty foods? Oil, because it's 100% fat, then cheese, or dairy in general, then meat, then nuts, and eggs. Okay, these are the 5 fattiest categories of food that we eat. If you take them all out in one shot, I'm not even saying everyone to do that, but just for like a giggle, take them out in one shot. If you're diabetic, I give just a few weeks, and you'll see how your blood sugar normalizes.
Wow.
It's not hard, it's so easy, and all of the studies that have reversed diabetes have done it within weeks, at most 3 months. But weeks. It's so easy, and people are suffering for years. And as the years go on, and they lose their eyesight more and more, and they have less and less energy because they're not eating carbs, because they're told not to eat carbs, and then they start having discoloration in their skin. And then they start being tired all the time. And then they're urinating all the time because they're not eating carbs, and we need carbs to hydrate our cells. And if we're not hydrating our cells, then we're always just urinating it out. Like, these are all aspects of being diabetic. Any diabetic will tell you. They go to the bathroom all the time.
Wow.
It's because their body can't absorb the water because they're not eating carbs, because they're listening to the diet that the doctor or the American Diabetic Association told them to listen to. Even though in published medical and nutrition journals that are accredited,
Totally different.
they've reversed it on even unhealthy low-fat diets, but definitely on low-fat diets in general.
I just want to show this photo. This could be your heart.
It's most of
This
our
could be-
hearts. It's most of our hearts. They are showing that there are infants that are showing fatty streaks in their arteries already
Wow.
from a mother's diet.
Wow.
Yeah, it's deep. Also, when they took young people, not just children, but up to the age of 21, who had died in a car accident, and their family allows investigation of the bodies, because that happens. Like, everyone has already shown signs of like the beginnings of heart issues, heart disease.
Wow.
Yeah, it's a modern issue. It's a Western issue from our diet. It's literally just diet, and it's so easy to reverse.
Wow.
And then if anyone's interested to learn more of the science of it, there are a lot of doctors out there who have changed their practice and not just integrate nutrition, but their goal is to use nutrition only and to wean their patients and clients off of their medication. This includes Dr. John McDougall, Dr. Neil Barnard, who actually headed that huge diabetes reversal study in the 90s. And he's still doing great work in New York. There's Dr. Caldwell Esselstyn, who no longer practices, but at one point was the head of the Cleveland Cardiology Clinic, which is like the clinic for heart disease and things like that in in America. And Dr. Dean Ornish too, like all of them, and Dr. Dr. Michael Greger, all of them, you can look them up and see the science that they have, that they've done over their decades of work, and how they've improved their clients' life just from nutrition alone and taking their clients off of medication.
I like the fact that you not only made those references, but people are constantly doing research.
Oh, yeah.
So it's not like you find some information and then that's it.
No, I mean, but that's philosophically, does it ever end?
Does it ever end? Well, well, that's the thing. Too many people that happen to go to school to be certain positions in society, doctors.
Or other people,
You know, and this is what this association says, or this one book, and they stop there, and it's an ongoing.
It's like it keeps going.
Yeah.
This just reminds me of physics. Like we've all had to take physics in high school, right? And the physics that we take in high school, up to what we get to, is from 200 years ago. And if you don't understand that, when you leave high school and you feel like you have an understanding of physics, then you're missing that, oh no, they continued on for 200 more years. There's just way more physics we don't know, but we're not physicists.
Wow.
So we only learned this, but we don't also have an understanding that, okay, this is up to this point. And I think it's the same thing with any other topic, including health. Like, so if you happen to have gone to medical school and you graduated in 78, and well, on top of that, they don't do nutrition in medical school, but even so, like even if it's other stuff, and then you didn't just do continuation studies, there's things we're always finding. There's new biochemical reactions they're realizing. They're seeing how certain things interact with each other. You know, fen-phen used to be legal and now we know it's illegal because it was killing people. Like there's a lot of things we learn as time goes on. And so everyone, including professionals, including civilians, including anyone who just cares about their body, keep reading, keep learning. And there's stuff that we know up to now, and there's new things that will come out in the next year and 2 years. Just keep investigating.
I think it's important to mention, anyone watching this for the first time, yes, this is Foodcaster, but it's about having a relationship with food. It's about this fuel that keeps you going.
Yeah.
And you really can't separate that from health.
Yeah.
You know, you can't have a cooking show without talking about, well, what is this doing to me?
It's this one thing that we, outside of breathing, is the only other thing that we do the most during our day. So it affects us a lot.
Right.
Most of us eat 3 times a day, sometimes more, sometimes less. And every time we eat, it's either increasing our health and wellness or increasing illness. And it's important to know what you're doing so you can just know.
You can't sit on the fence.
Yeah, I mean,
with that one.
Yeah, you just need to know what you're doing. So if you don't really care, that's cool. You don't really care, but I just want you to know. And another thing I want to talk about, because I didn't mention this symptom of diabetes, a lot of people diabetic will have numbness in their hands. And you might already know this if they cut themselves or whatever, it's hard to heal. I don't know.
No, I've come across a couple people with that,
anyone with diabetes understands that sometimes, you know, you just feel less and you'll end up burning yourself more because you didn't notice the heat as quickly. Part of the reason why there's numbness is the same thing. There's too much fat slowing down the circulation into your extremities. And this is why you'll have, they call it neuropathy, but numbness in the fingers. The numbness is because the blood isn't circulating through your fingers. And why is it
so would that be a good represent?
Well, I mean, they're just rubbing their appendages. You know what's a good representative? If they show like fat globules, but I don't even think they would.
Next to the leg right there, is that...
I see that, yeah. Mm-hmm.
That's it right there.
Deep vein thrombosis.
Wow.
Does it say that? Because that's kind of what it is. But this is also why when some diabetics cut themselves, it takes forever to heal. There's too much fat blocking everything. It's blocking everything. Like
and our machine is made to heal itself.
Completely made to heal itself.
Yeah.
It's amazing.
The most efficient machine known to man is man.
It's like the only machine that, as you keep working it out and using different aspects of it, it just gets better. Any other machine that we've made, it will like wear away because you've used it too much for 2 years.
Right.
Ours, if we don't use our machine, this is when it wears away. We actually have to get up and move and exercise our eyes and exercise our nose and exercise our ears and exercise our body and our brains.
So I just thought about something too. As you get older and people start losing weight, they start shrinking.
Yeah.
They need less fat, even more so.
They need...
Or do they need more?
No. They need less food.
Okay.
Definitely less protein, that's a big one. And then just a regular amount of fat. And I guess regular amount of fat, anywhere between 10 to 20% of your diet. And I hate talking like those things because I don't like when people like stick to it. It's not a big deal. But yeah, they need less food. And they definitely need less protein. And you might see that older people tend to have picky appetites. Because they're not making new things. Growing takes a lot. Like a child being pregnant or just like growing up until you're like 23. Look at how young boys eat. It's a stereotype.
Right.
Like 15 and they just chow down. They can eat a whole pizza. They just eat so much. Literally, they need the fuel to keep growing.
Right.
They need it to, and then they all say, you enter college freshman 15, but really as you go into your 20s, into your 30s, your metabolism slows down because you're not growing anymore. Now you're just maintaining. You're just maintaining. And then women will get that boost again if they're pregnant and because they're growing a whole nother being, and now you have to eat a lot. Or if you're nursing, same thing, because you're spending like 500 calories a day just from nursing. And so you need to eat a lot because you're producing things. Once you're older, you're not making newness. So you don't need as much fuel. And honestly, your life can be lived longer at that point, eating less food, because now you're not taking so much energy in digesting, and your body can just do other things to like give you life.
I need to just record that portion of this episode for a relative of mine. Yes. Because the theory is you gotta have the 3 meals a day and all the mini meals, and I'm like, but at your age, I would think you don't need that.
No, that's just too much. That's too energy intensive.
I need my protein. That whole, I need my protein.
Yeah, protein's in plants.
Yeah.
So you can eat that. And it takes way less energy to digest. Way less. And does not contribute to like the 4 main killers in the United States.
Which again are?
Heart disease, cancer, diabetes, and organ failure, like liver and kidney failure.
And everything you mentioned
is diet.
Wow.
Everything. All of that is diet.
You heard that. All of it is diet.
All of it.
All of it is diet.
Unequivocally, scientifically proven, data out there.
All of it.
Find it, research it. You'll find it. You'll see it.
I'm so excited.
Yay.
You know why I'm so excited?
Why?
It's because more and more people are having this conversation.
Yeah, it's good.
It's exciting.
Yeah. I think it's important because so many people, we can't afford like certain medical care. So it's like, well, why don't you just change this? That'll help you out a lot. And then it'll be more affordable to just live because you're just eating better. And that's the whole argument with like, eating healthy is expensive, which depending on how you want to shop, it's not. But, I hear that all the time, eating healthy is expensive. So let's say it is. Let's say it is like $100 more a week, let's say. Having heart disease is expensive. Getting that surgery is extreme. When people talk about, let's say, veganism is being extreme, no, cracking your sternum open and opening your rib cage to now cut open a vein in your chest and now put your rib cage back. No, that's extreme.
Right.
Is that really what you prefer? Is it better to go under radiation and chemical therapy, which is chemotherapy, which is at an acidic level of 1, which is highly acidic? Is that more normal than just eating plants?
Well, if you put it out like that.
I'm just saying people love to use the word extreme, and I'm like, extreme? I mean, I've seen some extreme stuff. My mother was on chemo for many years. That looks extreme and painful and wretched, and a type of life one doesn't really aspire to live in. Right. So what's more extreme? Right. You know, and the thing is, the power is in our hands. And that is one of the things I really want people to understand. Some people feel like, oh, why did this happen to me? Why me? Like, there's nothing you can do, and you're just beholden to this illness or this disease. And really, all of this is like, oh no, mostly this is your lifestyle. So you can actually just regulate this dial, regulate that dial, regulate this dial, and you can halt progression and reverse progression. Some people are not ready to take that ownership of their control, though. And I understand that could be a really big psychological block for people. It's easier to say, there's nothing I can do, than to know there's something I can do and I don't want to do it.
Right.
But then that's just a personal problem.
Right.
That's just a personal problem.
Right.
And that's something that people have to just sit with themselves.
Right.
Yeah.
Yeah, because if the research is out there,
and it's out there,
and I say, and I'll say it again, try it.
Yeah, why not, right?
I say I think you said like do a month. I say 3 months, just 3 months.
Yeah.
And if the signs are better, the energy is better, then you know it's doing something. And if you feel the same, then maybe you got something going on that we don't know about.
You know, I do something with this woman called the Vegan Reset. And so it's a program that's like 28 days long, and we do it throughout the year. And right now we're in the middle of one, and this woman has a personal trainer. Now, I was a personal trainer too. And I know the jargon we used with food as a personal trainer.
Right.
I know it because I was in it. Though it never really resonated with me even before I knew other things I knew. So I didn't push the things that they usually told people about, like protein and yogurt. I didn't do that. It just didn't resonate with me. So I just focused on the exercise. But this particular woman in the program, her trainer said, oh my gosh, you're never going to lose weight this way, because she saw the program. And it's all whole foods, no processed sugar. Like, it's like good food. And you're cooking. It's a cooking program. And you're never going to lose weight. It's going to be too much. And the woman in the program was like, I feel so good, though. I feel so good, and I'm sleeping really well. And then I'm waking up better. And so it's like, it's hard because that trainer thinks they know a certain thing about food and diet and health and weight loss, and cannot hear that our client is saying, I feel so much better.
Right.
Yeah.
And then what is the goal? A lot of people, the goal is to just lose weight and just that aesthetic. Not to
if they
look
want
better.
that's their own,
but that's what,
personal choice.
You know, we could probably do another show about that, the pressures of society and stuff. But a lot of people go for the aesthetic and not necessarily feel better.
And that's their personal choice. Everything that ever engages me and inspires me is about being healthy.
Cool.
And I know I've said it before. Like, this is the only home I have. This is the only home guaranteed to me is this body, and I want it to work as well as it can.
Cool. Give us your social media.
You can find me at Sam Eats Plants on Instagram. Doing it up.
And I like when you say that, and I always say she does. And this is Michael 7. Michael, thank you so much. You're watching Foodcaster. Keep supporting. Leave comments. Tell the cable company you like the show. Just keep supporting, and we'll keep giving you information. You're watching Foodcaster.